Calarco Leadership Lecture. With the power of this virtual gathering, we are being joined today by nurses from around the country, students and faculty at the School of Nursing, alumni as they celebrate Homecoming Week, and nurses from various sites across Michigan Medicine. This lecture is truly a gathering of our nursing family, as Dr. Calarco envisioned when the lectureship was created. I'd like to take a moment and share why this lectureship was created. In recognition of Dr. Margaret Calarco's 17 years of service as Chief Nurse Executive at Michigan Medicine and her dedication to nursing leadership education, Michigan Medicine endowed a lectureship in her name. The School of Nursing was asked to be a co-sponsor and to plan alongside Michigan Medicine, underscoring the commitment to a strong partnership between Michigan Medicine and the School of Nursing. The aim for this lecture was to focus on leadership, an area that Dr. Calarco spent her entire career studying, researching, and exemplifying through her leadership of multiple groups and organizations. It is my honor to introduce today's speaker, Dr. Patricia Davidson, Dean of the Johns Hopkins School of Nursing. Dean and Professor Davidson have been a registered nurse since 1980 and has clinical, teaching, and practice experience in cardiovascular science and care of vulnerable populations. Across her career, she has been committed to the development of innovative models of person-centered care delivery and evidence-based teaching. Dr. Davidson is Secretary General of the Secretariat of the World Health Organization's Collaborative Centers for Nursing and Midwifery, Consuls General at the International Council on Women's Health Issues, and a board member of the Consortium of the University of Global Health. She also serves on the National Academies of Science and Engineering and Medicine. She is deeply committed to diversity, equity, and inclusion, and workforce development and interdisciplinary practice. Dr. Davidson is strongly focused on mentoring the next generation of healthcare professionals and scientists. And in 2016, she earned the Australian Museum Eureka Prize for Outstanding Mentor of Young Researchers, the most prestigious research mentorship award in Australia. She is Associate Editor of the International Journal of Nursing Studies and on the editorial boards of numerous other journals, including the European Journal of Cardiovascular Nursing, Journal of Cardiovascular Nursing and Heart and Lung and Circulation. We are excited to hear her presentation today, and we will be taking Q&A at the end of her presentation. Please help me welcome Dr. Davidson. We look forward to hearing your talk today.
So thanks so much, Dr. May, and also my sincere thanks to Dean Hearn and Colleen Zimmerman, who have helped organize this talk here today. And it's really an honor and a privilege to be giving the Margaret M. Calarco Lecture here today. As I read her background and her huge commitment to clinical care and the intersection of the academy and clinical practice, I thought, what a phenomenal nurse leader. And I will really try and do her legacy and her reputation justice. As I've mentioned, Dr. Calarco was a trailblazer and has laid the foundations, which I'm sure have led, even in this pandemic, to Michigan Medicine being a robust and resilient healthcare organization. Just before I start my talk, I want to give tribute to all the nurses throughout the world, the nurses that are listening today. We know that 2020 slated the year of the nurse and the midwife by the World Health Organization was nothing like we thought it would be. And during my talk, I want to share some of my reflections and also some of my vulnerabilities during the COVID-19 pandemic, because I think this really speaks to leadership. And for all of us at this time, this has been a major crisis, and in some ways an existential crisis and a reckoning of our profession, but also a commitment to the strength of our profession as we move forward. So to all of the nurses who are listening today, thank you, and please keep safe and well. And for the students who are watching this talk, The world has never needed you more than ever. And so thank you for choosing nursing as a career. So what I want to do over the next a little while is talk about the social, political, and economic factors influencing healthcare. So if I reflect on my own leadership or clinical trajectory, I went to a diploma program in the 70s in Australia. And in those days, it was all about the hospital and pretty much isolated from the community. And it wasn't until I became a clinical nurse specialist, which I spent 20 years as a clinical nurse specialist in cardiovascular care, that I really recognized that thinking beyond our profession, thinking beyond our organizations to social, political, and economic factors is critically important. And now in the COVID-19 pandemic, these factors are firmly pronounced. I also want to reflect a little bit on the impact of COVID-19 on ourselves, our organizations, and our profession. And I want to think about moving forward. What are some of the opportunities and challenges in future-proofing our health system and our profession? So I put this up here. So I've been doing a lot of writing and thinking at this time, maybe because I've never been busier than ever, but in a way, I've also not been as so distressed as I have in my nursing career. And I've had to admit many times I was wrong. So as the pandemic started in January, February, and people were talking about Wuhan. So I'm actually been a visiting professor in Wuhan, China many times, and I actually am an adjunct faculty at the Hangzhou University there. And I kept saying, no, look, yes, it's bad there because look, the hospital has 7,000 beds and they're all close together. No, it can't happen. Then when it went to Italy, again, I can remember myself saying, no, look, we'll be fine. Things are different in Italy. We have this amazing health system. And I don't think anybody could actually think about the devastation that has occurred. And for many people in leadership, people like me, I think, how did this happen? How did we let it happen? How did it become so bad? How has it been that some of our colleagues have died? And many people in our care have died. Now, working at Johns Hopkins, we're fine. Working in Michigan Health, I'm sure you're fine because we're part of robust, resilient health systems. But can I tell you the stories that I've heard from my alumni, my faculty, are heartbreaking. One of my students in the Doctor of Nursing practice was working in the ICU in the Bronx, taking care of 4 patients. Some of our students, one of our students, I'll have her photo later in the presentation, Sherry Chen, was from New York and New Jersey, and Cuomo said, when you go help, will you go and help? She went and helped. She's currently a student in our family nurse practitioner program, but where did she find herself? In a nursing home, wearing garbage bags for a gown, reusing masks, and finding herself in a place of suffering. So these are some of the things that I've been writing and thinking. And I really urge each and every one of us here today that yes, we will, we hope, get a vaccine. And yes, it will, we hope, get better. But this can never happen again. And what COVID has done has really cast the spotlights on many frailties in our systems. But in the United States, in the richest country in the world, in the country that everyone else around the world looks to for discovery and innovation, we really have to think forward as to how this cannot happen again. One of our alums, 2 of our alums to be precise, who graduated from our MSN MPH program and were working with MSF, where did they find themselves deployed? Not to Sierra Leone, not to the DRC, but to working in nursing homes in Detroit. These are really critical issues and critical conversations. And in the context of a leadership lecture and really a recalibration of where we're at, I really want us to think about some of those issues. So how did we kind of get where we are? And what do we need to think about? So I know many of my colleagues at University of Michigan who are collaborators with the WHO collaborating centers are really comfortable of thinking about this framework, thinking about healthcare within macro, meso, and micro phenomenon. And as I mentioned, we no longer can be our individual health system in our individual city or county and not think about the macro agenda, the social, political, and economic factors that influence our healthcare delivery. I must confess, again, as a leader, to be honest, I sit on many of the Hopkins medicine committees, and when people would mention supply chain, I would kind of glaze over and think, not me, not really my issue. And to be honest, a little bit boring. But now that I think every nurse manager, that is what they get up thinking every day, is about supply chain. Will I have enough PPE to protect my patients? Will I have enough equipment to take care of the patients? And also, how can we get through this day safely? The thought in my lifetime that we would be reusing masks is something, again, I wouldn't, if someone had asked me 2 years ago, would that have happened? No. If I would have thought of nurses wearing garbage bags for aprons, would I think it's possible? No. And I think what we recognize as people like me who works in a robust health system and like you at the University of Michigan, we have been lucky because we are working in systems. And that's probably, to be honest, in the context of managing a pandemic, a bit of a fortuitous accident, because we know that the acquisition of hospitals and facilities has largely been motivated along a business imperative and the need to get economies of scale and efficiencies, not necessarily a mechanism for managing supply chain and managing workforce. So within the context of the pandemic we have to recognize that we have to think about the factors that are going on in our society. So we know we live in a very complex time. There are moves towards nationalism and populism. And we know that our climate and our world is being impacted by climate change. And we know that we're now in the Anthropocene era, the first era in which the climate has been impactfully moderated by human involvement. And hence, that is part of the backdrop to the coronavirus. And we also know, and we increasingly are aware of, the importance of social determinants of health. So I'm sure like you're in a stellar academic health sciences center. You go to grand rounds and there's so much talk about personalized medicine and genomic medicine. But we know as nurses that poverty, access to care, environmental exposure, and racism are the big mediators of adverse health outcomes. And that doesn't matter if you work in neonatology or palliative care. People who are born in poverty often die with suffering. So this is the world we are living in. And then COVID happened. So what has COVID done to our world and our health system? Well, firstly, it's laid wide open and bare the cracks of social inequalities. And it's also accelerated a huge number of factors, such as telehealth. It's estimated that by January next year, there will have been over 1 billion telehealth encounters in the United States. And that's a good thing, but it's also not a panacea. This morning, I was at a meeting about disability, and a disability advocate sort of pleaded to the health professionals saying, you know, telehealth is not necessarily the answer for everything. In some instances, it can augment marginalisation and isolation. And then the other thing that COVID has done to the world, it sends shockwaves. It has caused economic devastation. And even this is the first recession that the healthcare systems have been impacted adversely. And across every health system, millions and probably billions of dollars have been lost. And we're not really quite sure of what the workforce and the employment structure will look like into the future. Will there be more sick people who are needing our help and assistance? Yes, but will there be the ability to create jobs and to fund a range of services? That's what we have to watch and wait. But what we do know is that we're entering a very challenging time economically, which inevitably is going to impact upon healthcare and how we deliver healthcare. Also within the context of COVID-19, we've seen huge health disparities, and this just shows mortality rates by race. And I know in Baltimore, where I live, it's the Latinx community that have been most profoundly affected. And also one of the things that COVID-19 has shown is that infrastructure and access to services is not equally distributed. So we know in the crisis of the New York epidemic, standalone facilities were the ones that did the worst. And so what does that mean moving forward? How do we structure healthcare systems? How do we make sure that we can manage ICU beds? How we can distribute patients to make sure that we have enough negative pressure areas, that we can make sure we have enough PPE. And we can also manage our staffing to make sure that nursing workforce and other healthcare professionals is equally distributed. And then in the midst of this healthcare crisis, we have this collision of a range of factors, and we know the social unrest is impactful and palpable. I'm sure in your communities as well, but here in Baltimore, I feel the suffering of people of colour, and they are angry and they're tired, and we're in the midst of a pandemic and just everything seems harder. And even if we do get a vaccine, we are seeing this increasing distrust of institutions. And in Baltimore, where I live, Johns Hopkins has a mixed bag in the community. Even though around the world it's seen as a stellar health institution, to many people of colour in the community, it's seen as a place of discrimination and, in years gone by, potentially mistreatment. So where we find ourselves now, which I think is really important as nurses and healthcare professionals, wherever we work in the healthcare system, is that for the most part, we are entering an era of syndemics. And this was a term coined by Merrill in 1993, but it really relates to what happens when we have two or more conditions that synergistically contribute to an excess burden of disease in a specific population. And it may include epidemics of both diseases and the contribution of social factors. So we see some real examples of this, particularly in the South with HIV and COVID-19, and what we have also seen where there's been, high rates of cardiovascular disease coupled with poverty and social exclusion and marginalisation. So I've given you a whole lot of information, a big backdrop of where we're at a macro level, a world which is increasingly fragmented, where tensions are higher, where moves to nationalism and populism are marked, and a country that is has been ravaged by the COVID-19 virus, on top of this social unrest. And as we come into the election, political mistrust and anguish. So, like most nurses, and we all have our political affiliations and beliefs, but healthcare should be a bipartisan issue. Healthcare should not be, access to healthcare should not be dependent upon your political beliefs. And also, acceptance in society should be something that is a given, particularly in nursing. As you get older, you get asked to do these talks, which is such an honor. And I was asked recently to do an interview, and someone said, what made you interested in vulnerable populations or health disparities? And I thought for a moment and I said, I think this is about nursing. I've never met a nurse who didn't care about the vulnerable. I have never met a nurse who has not wanted to make sure that everybody had access to the best possible care. So we need to own this. We have to own health as a social justice, boldly and proudly as part of nursing. But with so much anguish in our world, we have to go back and look at our history and our structures. And in the midst of some of the challenges of COVID-19, the pain that I see in my colleagues, the anguish that I hear from our students, I've had to think we have to go back and look at our history and our structures. And I'll bring you back to Florence Nightingale and really how in the year of 2020, where we celebrate Florence Nightingale, we celebrate her as a first statistician and epidemiologist, we also have to be aware of what were the foundations of our profession. And also in 2020 is the year of celebration of the centenary of suffrage, where we know our African-American colleagues were excluded from the vote. So we have to think about what is our profession and how do we open it up? How are we inclusive? And it cannot forever be a white woman's profession. And how do we welcome diversity into our profession? One of the stunning facts that I heard within the context of COVID-19 is that Philippine registered nurses in the United States represent about 4% of registered nurses, but have been over a third of the COVID-19 deaths. So this tells us a little bit about what is the class system within our profession. Where are the situations where individuals have to work? And we know that there is limited relative to population representation of African-American and other people of color within our profession. And we also know, if we're striving to make sure that our profession reflects the populations that it serves, that across the nation, maybe in some of the very top schools, 14%, 15% is the maximum number of men you will see across schools of nursing. So we have to, as we look at our history, celebrate the foundations. And in particular, who would have thought in 2020 that the nurse epidemiologist Florence Nightingale and her ways of looking at data and monitoring trends would be so impactful. And we've seen how this management of data has really led the management of COVID-19. So what do I make out of this? And what do I think about, particularly in the context of nursing leadership? And many of us who work in global health are aware of the terms health system strengthening and human resources for health. And these are actually the 6 building blocks of a robust healthcare system determined by the WHO. And as you can see here, these pillars, leadership and governance, healthcare financing, access to medical products and technologies, information and research indicators, service delivery and workforce, For many of our nurse managers who are here on the call today, these are the things that have made healthcare systems and hospitals resilient. But yet, in a very individualistic model of healthcare in the United States, and not just in the United States, many countries around the world, healthcare is more about competition and profit than collaboration and efficiency. And we as nurses really need to take this forward. So what I'm going to sort of now talk about is how we seize our power. Now, never before have nurses been probably so visible and recognized. So it's fabulous to see the faces on nurses in buildings. But how are we going to be included? Just here, this is Jason Farley, one of our faculty members who's done a phenomenal job in COVID-19, sort of bridging the hospital and the community. And how do we make sure that amazing nurses such as Jason are at the table? How do we make sure that nurses are a part of the coronavirus task force, not just tokenistic, thank you for doing what you're doing, but meaningfully engaged in decision-making and developing models of care? So I think that's where we are now. We're visible, we're have increased recognition, but are we necessarily as powerful as we could be? And also we have to recognize the privilege of where we work in academic health sciences centers, particularly Michigan Health and Johns Hopkins Health, where nurses are held in regard. We have seen in our colleagues across the nation, nurses and physicians being fired for speaking out about not having PPE and speaking out about the quality of care. We have to make sure that we are at the decision-making tables, and we are at a critical juncture in the time of our history. So I mentioned, this is Sherry Chen, who went to New York, like many of our colleagues, and I'm sure many nurses too from Michigan, went to volunteer around the country. It really speaks to the selflessness of nurses and their commitment to taking care. So while many people have bunkered down, many of us have walked to the conflict and been proud and courageous in those efforts. Now, one of my colleagues and friends and mentors, Dr. Sharkey Katefian, who I'm sure is watching, asked me specifically to talk about this. And I think this is part of what our power is about. We have to recognize that we're just not kind and compassionate and competent, but we are smart. And this means recognizing nursing as a STEM discipline. Yes, we are scientists. And Jason Farley, that I presented in just some of the slides before, was just recognized by the Academy and the Robert Wood Johnson Foundation as one of the Courage Awards as a scientist in the context of COVID-19. So he's been working with engineers to create Perspex hoods to enable safer intubation. He's been working with the community for more effective screening practices. So we have to grasp our credibility. We have to grasp our power. And I really think that nursing should be considered as a STEM discipline. And why is that important? Because it increases recognition, it increases funding, and it firmly establishes us as a scientific discipline. This does not mean that you are not caring or kind. It means that you are being recognized for all of those things, but also for your intellect and the strength, the science of our discipline. And we know from data from Dr. Aiken and many others that the level of education is directly related to patient outcomes. That's why within the magnet health system, baccalaureate education is favoured. And what we've seen in nursing homes, sadly, is the exact opposite. And I've often said, you know, the term skilled nursing facility is actually an oxymoron, because it is very hard often in those facilities to find too many nurses. We know that Medicare data has shown many breaches within nursing homes where people are only required to have a registered nurse on duty for 8 hours a day. And many nursing homes had been cited for that, but no one had really followed through. So just as in the context of the pandemic, many of the vulnerable have become even more vulnerable. And the curtain has been pulled back on some things that as a society, we should really think long and hard about. How we've cared for those who are disabled, how we've cared for those who are elderly and in nursing homes. And I still worried and concerned about how in 100 years' time, when people look at how we manage this pandemic, how history will judge us for the times of keeping people in up to 8 months secluded in nursing homes without access to family and friends. That is a tough call. But what we need to do is make sure we have environments that in aged care facilities where we can flex to some of the threats of infections and pandemics. So in the context of taking our power, I really commend you to have a look at this article by Chris Love in 2020 in Forbes magazine. And Chris Love is the president of Pace University in New York. And he writes what we have known for many years, that 85% of respondents graded the honesty and ethical standards of nurses as very high, having a percentage point 20 points higher than others. And he talks to the fact, and he actually in this article interviewed the Dean of Nursing, and arguing that empathy, reliability, and advocacy should be placed at the centre of other professionals' training. And he actually was speaking about the MBA. So how are we going to really leverage, firstly, our power, our science, our voice, and our position in the society to make sure that the world following COVID-19 is a different one? And as I've mentioned, there'll be many things that we really need to investigate in terms of whether we have really done the right things in the context of this pandemic. And we also have to make sure that everybody is treated equally. We know that probably 1,500 nurses have died from COVID-19. Now, if someone falls off a crane in a building site, there's an investigation, it's reported, it's considered. But many nurses maybe will have died because of frailties in the system. And those of us who work in strong systems know that donning and doffing is not as easy as it sounds, that you need someone who's going to monitor you, someone who's going to help you take off your equipment. And so how do we make sure that these skills are generalizable across the community? So I'm going to sort of end the talk a little bit by thinking about some of my reflections on leadership in the context of a pandemic and how we have to move forward. And just this week, I saw this article from Edmondson and Chamorro Presmich, and I thought, gosh, that really sums up where I have been in the pandemic. Firstly, I don't think anything in my career has changed so much in real time. Wearing masks, not wearing masks, N95, no N95, PAPA, no PAPA. Does a negative test mean you can go into work? We have all been living in a zone of uncertainty. So I've had to learn to say, I don't know, I'm unsure. Today, this is what I think is the best thing. I've had to ask for help on so many numerous occasions, reaching out to people who can help me in terms of making decisions. I had to go outside of my comfort zone on many instances, largely because of the fragility of many people working in our health system and our school, and the suffering and the death that has happened. We know that across the nation that the number of excess deaths is remarkable. And can I tell you, in my school alone, which has probably got 100 faculty and 200 staff, we've had 15 bereavements since March of close relatives, some from COVID and some not. So how do we deal in those times of tragedy and sadness? And when you make a mistake, admit it and apologize. I think these are really important lessons that we've learned in the terms of COVID. And I think one of the great things that has happened in our health system anyway is that there has been greater teamwork across the physicians and nurses. And I've heard stories of, physicians being, if you're in a PAP or in a room and you need a drug administered, people saying, will you help? So I think COVID-19 has put also a different lens on nursing and a different lens on leadership. And it has been a lot about dealing with uncertainty and unpredictability. And each and every one of us now, I'm sure in Ann Arbor, you're thinking exactly the same thing. What are the next 4 months going to be like? And will we get through it? And I just hope everyone around me will be safe. So in terms of Dr. Calarco, what I think about what she espouses, why this lectureship is so important, is that really in her career, she has put a spotlight on leadership, on the factors that what make a positive organizational culture, and what is the impact of practice environments on patient care. COVID-19 has set a spanner in the works, that's for sure. But also this crisis has allowed us to look at a lot of systems and processes within our health systems, and more importantly, underscores the importance of health systems, which I think in many occasions we do not fully embrace. So what do I take within the context of Dr. Calarco's vision, what we've learned from COVID-19, and how we work to make sure that every person, every time gets exceptional care, is that we need to understand the population. And this means thinking about social, political, and economic factors, just not what's happening in my backyard. We need to refocus and double down on diversity, equity, and inclusion. We need to foster research that is patient-centered, outcome-focused. And we have to, particularly in academic health sciences, whereas there's always the pressure for the pointy end, we've got to double down on the importance of the social determinants of health. We cannot ignore the role of monitoring, evaluation, and accountability in healthcare. And we have to engage the political process if we're going to make a difference for the people that we care about. And what I really want us to do today is to seize our power, move from visibility and recognition to inclusion and engagement. So I'll just finish with this last story, which I think is very telling in some ways of we've come so far, but yet we've got a ways to go. So this scene is probably reminiscent and familiar to you. This was the briefing outside Walter Reed when the president was hospitalized for COVID-19. Someone from the press asked the physician, what were the president's occurrent oxygen saturations overnight. And I think he replied, well, we should better ask the nursing staff. So wouldn't it be just fabulous if the nursing staff were there delivering on the report? And we know in the United Kingdom, the Prime Minister, also Boris Johnson, when he came out of the hospital, named the nurses by name overnight who had diligently monitored his SATs and made sure that he was safely discharged from hospital. So thank you for your indulgence of my time, your time to talk about my rantings, the things that I care really passionately about. Thank you for all you do. One thing about being an older nurse is that you do see that things change and things do get better. And in my 40 years as a working nurse, I've seen amazing advances. So for the students here today, be safe and well, take this phenomenal education that you have, go forward, use your science, seize your power, and do great things in the world. Thank you very much for your attention. Just one thing that I did want to finish with. Sorry, I should have gone thing. I really commend this book to you. This is The Great Influenza by John Barry. And I had to read it because I was doing a panel with him. And he wrote in that book that in 1918, nursing could give the victim of disease the best possible chance to survive. Nursing could change lives. And that was in 1918. And I really believe in 2020 is exactly the same. And then I just wanted to share just a quote from one of our doctoral students, Nadia Andrade, who has worked with MSF in Sierra Leone, in Syria, in Serbia, and went to volunteer in New York at the height of the pandemic. She said that was one of the toughest assignments she'd ever had. And she was an intensive care nurse. And, you know, there was lots of discussion about ventilators and where they were going to get it. And she said, an intensive care bed without a nurse is just another place of suffering. So that really is it now. So thank you so much for your attention, and I look forward to your questions. Thank you.
Thank you so much. If we could all applaud for you, we would at this point. So we could do a virtual clap. It was a great presentation and really, truly was enlightening with all your experience that you have in your field and sharing your stories. I think one of the things that nursing just does an amazing job is to tell our story. And we've been highlighted in many ways throughout this pandemic. And I think Florence would be very proud of nursing and how we've not only shown up and stood up, but really did the right thing for our patients. So we do have a few questions. And for those of you that are interested in putting a question in, just type it in the Q&A and then I will read it to Dr. Davidson so she can respond. So our first question is, thank you for your very enlightening talk. As someone with a family member who permanently moved to Australia about 30 years ago, partially for social attitude reasons, could you speak to the power of nursing and midwifery in Australia versus in this country? Thank you. And that was from Katie Oppenheim, our president of our union.
Okay, so thanks so much, Katie, for the question. Can I tell you, it's pretty much the same there. And people look to the US as the pillar of nursing leadership and advancement. So it's very similar. We have very much the same issues of power and accountability as here in the United States. The question about midwifery is that midwifery is much more prioritized because it's seen as an independent profession. And in fact, it's people licensed specifically as midwives, not nurse midwives. But that just goes to show that we have a lot to learn together to address some of these complex challenges and problems.
Thank you. This is somewhat of an editorial, but I noticed that some of yours were editorials that you wrote into journals. So this is a comment, and it's to be successful and to be at the decision-making table, we have to be involved with the political power structure. Florence Nightingale might have not been so successful if we were not for the other factors such as the telegraph, with communication being sent from Crimea back to London and to the attention of society and leaders such as Queen Victoria by a newspaper reporter as well as photographer on the ground who sent photos of the conditions and the role that nursing played back to London. So we need to have more nurses run for office at local, state, and national levels with communication about our work. And so I could not agree more from our person who posed this question. Do you have any comments on that?
Well, I think it's absolutely correct. And, you know, we share Lauren Underwood, you know, please, there's a video that Dean Hearn and I just recently developed because we nominated her for the Academy. And also there's the power of the media. So we know that, you know, from the Woodhull study that only 4% of nurses, of stories about healthcare are from nurses. So we also need to get better at engaging the media. But a lot of that is still confidence. We all have a good dose of imposter syndrome. And part of that is the cultures that we're brought up. We're not necessarily, you know, in nursing schools say empowered to be the spokesperson. And I think in our schools, that's really changing. You see people like Lauren Underwood, and I think I want to be like her when I grow up. I mean, I have never been that confident or articulate. But I absolutely agree that's what we have to do. And that's why schools like ours are so powerfully important, because we get the brightest and the best students, and we have to make sure that they get the knowledge, confidence, and skills to be able to take us all forward, not just nursing, but patients and their families.
Okay, thank you. The next one is, thank you for your presentation. Any thoughts on how to address the hierarchies that you mentioned within nursing?
Look, I really think we have to get to the importance of the healthcare team. I think we have to value everybody in the healthcare team. You know, I started off in my career as a diploma nurse, and some of my colleagues are still working it. I tell you, I feel like I got excellent training as a diploma nurse. So I think it's about respect and valuing what everybody brings to the equation. You know, those of us, I mean, one of the great things about the pandemic has been the spotlight on frontline healthcare workers. We all know in hospitals, you know, who makes the world tick. And often we know it's the ward clerk, the person that is the most powerful person on the unit, if you really stop and think about it. So I think it's about valuing people. But what has happened has been this real reckoning in aged care and school nurses. You know, I was asked, someone reached out to me who was a school nurse, we had done some things, and they get paid, some of them get paid $14 an hour. I mean, how do you recruit? I mean, and again, that's another area that has been so important. So what we need to do is make sure that we keep our foot on the pedal, and this just does not go back to what it is. The other thing is, you know, I've done quite a lot of work in nursing homes. The certified nursing assistants are phenomenal. They love the patients. They take phenomenal care of them, but they're not trained. As I mentioned, one of our alums who was working in Detroit, you know, she was basically even teaching the cleaners how to clean. You know, you don't clean from a dirty to a clean area. You clean, you know, the other thing. So some of those things are just so basic. But I think if we develop a culture of kindness and respect, you know, that should work. But we all know in our profession that has not always been the case.
All right, thank you. Another question is, do you have any suggestions for how we in the United States of America can rebuild our public health structure, which has been disseminated in the last 40 to 50 years? Money comes in crisis and is not allocated after the crisis to prevent the next problem.
So I think you're absolutely right. The public health system has disseminated. So we really need to work with advocacy. We really need to look at the intersection of knowledge. I mentioned I was on this disability call this morning and people was talking about public health, embracing the whole person, etc. And I think nursing does that. What are we looking at? Thinking about combined nursing, public health degrees. How do we make sure that everybody has these core skills and competencies? I think it's really important. But we know that it is really the fragmentation or lack of a health system that is where the US is at the moment. And I think there'll be lots of postmortems, but, it's up to people like us who know what they're doing to be having a voice. And that's why, if we could clone Lauren Underwood, that would be great. But even so, just making sure you're reaching out to your local politicians for a coordinated approach. And it's a very hard time. What's happened to your governor in Michigan for standing up for what is right is challenging. So, I think through concerted lobbying processes, that's what's going to happen. But it will need a coordinated approach.
Maybe we can take one other question, and it's from one of our nurses here. It says, I have never been more proud to be a nurse than I was during the pandemic. Seeing how our community came together was inspiring. What strategies would you recommend to keep our nursing and nursing leadership community emotionally and mentally healthy as we continue to face these types of challenges?
Well, I absolutely agree. I think recognizing kindness and heroism and recognizing it's okay to be vulnerable. That's what I've really seen around my colleagues. And I'm going to tear up just even thinking about it. But one of our amazing chief nursing officers, Leanne Sidoni, who was at Suburban Hospital, the day that the fridge came, for the morgue overload, she said that was just one of the darkest days. And like all of you, many of the nurses, none of us were didn't choose this. Many people were really scared. How did they go? And were also really challenged about, seeing people die alone. So one of the most amazing things that the management did, the CNO and the leadership, they said, we can't subject our nurses to be taking these patients to a makeshift morgue. They just felt that was just asking just a little bit too much of them. So I've just seen these amazing acts of kindness, of compassion, of consideration. And all I can say is, just keeping in contact, having a buddy. I've actually looked to some of our faculty who have been deployed in the military and say, what do you do if you're in Afghanistan? So, one of the things that I really think about is really important is just having a buddy and being able to talk about it and to be able to talk and say, I don't know, I'm scared, I've made a mistake. And I've just seen a different level of vulnerability, humility, transparency, and kindness that I have in many of my times, and even with the physician colleagues. So I think just putting our arms around each other, but, how do we take some of these things forward? I think are important things to consider.
Thank you. This last comment is from actually Dr. March Calarco, who's listening in on your lecture
Oh.
today. So she says, I want to thank Dean Davidson for his thought-provoking lecture and thank everyone who has attended today. The importance of always using our voice and our science to influence the health of the world is at the heart of our profession. I also want to thank Dr. Spollinger for creating this lectureship and Dr. May and Dean Hearn for moving this work along. My many thanks, Marge. So thank you, Marge. We are in awe of your leadership. As always, we so appreciate all the foundation that you have led for us to move forward. And we truly appreciate the lecture. It's been a great joy to have Dean Davidson with us today. And we so appreciate your wisdom. Thank you so much.
My sincere thanks. And Dr. Calarco, kudos on your legend. Everyone talks to me about how admired and revered you are. So you've left some great foundations. So thank you very much.
With that, we'll end. Thank you so much.
Thank you, everybody.